Hello, my dear juniors. I am SHUVRO BHATTACHARYA from Medical College, KOLKATA, and welcome you all in Medical Easy, where I want to discuss the INFEX. INFEX, femoral triangle, femoral sheath, adductor canal, and also the knee locking and unlocking in a animation pattern. Okay, so let's start with the femoral triangle. First of all, you have to know what is femoral triangle and where it is located actually. So femoral triangle is a depressed area which is actually intermuscular space, and this intermuscular space mainly present in the anteromedial aspect of the proximal thigh. So what is the meaning of these terms? So actually this is the anteromedial aspect of the proximal area of the thigh. It's very easy. And this is actually intermuscular area, and it is a triangle. Okay, it is a triangle and it is a depressed area. Okay, and line immediately distal to the inguinal ligament. Okay, so that's it. This is the femoral triangle. So let's look about that. So this is the femoral triangle, and this part is the inguinal ligament, and there are some muscles. So it is intermuscular. So we have to know what are the muscles, what are the how bound the femoral triangle, what is the base, what is the floor, and what is the content of this femoral triangle. Okay, so let's start with the base. The base mainly formed by the inguinal ligament. So this is actually the inguinal ligament. This is the pubic tubercle. Okay, and this is the anterior superiliac spine. There is one muscle. This is one muscle. What is this muscle? Let's come to this picture. You clearly notice one muscle starts from originating there, and this is the muscle, and this muscle is actually the sartorius muscle. So this is actually the sartorius muscle, and there is another muscle which from actually present the medial to the triangle. What is this muscle? This is actually the adductor longus muscle. Okay, so this is actually the adductor longus muscle. This is the adductor longus muscle, and this is the sartorius muscle. So sartorius muscle mainly present in the lateral side, and the adductor longus muscle mainly present in the medial side. So from the medial boundary and sartorius from the lateral boundary. It is very clear, very easy. But there is one concept. Which concept? Which border of the which muscle from the boundary? You can clearly remember like that. Medial border of two muscles from the boundaries. Simple. Medial border of the two muscles from the boundaries. Adductor longus, medial border. Sartorius, medial border. Adductor longus from the medial boundary. So which border of the adductor longus? The medial border of the adductor longus. And which border of the sartorius? Medial border of the sartorius from the lateral boundary. It's very easy. Now come to the floor. In the floor, there are four. First one is the iliacus. You can clearly notice. This is the iliacus muscle. Then the psoas major muscle. Then the pectineus muscle. And last of all, there is the adductor longus muscle. So adductor longus muscles from the medial boundary, also the floor. So, okay. So these four muscles mainly from the floor. In the sequence, adductor longus, pectineus, psoas major, iliacus. Okay. Now the most important structure of this triangle is the roof. So in case of the roof, first of all, what is present there? First of all, there is also a skin, obviously. After removing the skin, we have the deep fascia. What is the fascia? In case of our leg. In case of our leg, this is the fascia lata. Okay. And then in the fascia lata, there is a modification of the fascia lata, and this is actually called the saphenous opening. And the saphenous opening is mainly covered by a septum, and this septum is called cribriform fascia. Okay, this is the cribriform fascia. So this is saphenous opening. Wait. Yes, this is the saphenous opening, and this structure is the cribriform fascia. And from the saphenous opening, there is a vein. This vein is the great saphenous vein. Okay, so great saphenous vein facial artery is actually superior to the roof, and when the great saphenous vein coming for the draining and it pierces into the saphenous opening, they give three branches. What is present in the medial side to the femoral triangle, our external genitalia? So one vessels should come in our external genitalia. So this is our pudendal vessels, the external pudendals. Okay, one vessels or one vein come to the above. What is above to the femoral triangle? Our epigastric region. So there is the epigastric vessels, and one present and in the lateral side. What is this? This is circumflex iliac vessels, and all are superficial. So please attach the superficial term in above or in front of everything, like superficial circumflex artery, superficial circumflex epigastric artery, superficial external pudendal artery. Why I am saying artery? Because there is an artery following the veins, and these artery are the branches of femoral artery. Okay, so there are these things present in the roof, and also there is superficial inguinal lymph node also present in our the roof of the femoral triangle. So very easy. I am quickly revise again. First of all, the skin above, below the skin there is facial artery. In the facial artery is special opening. The opening is called saphenous opening. The saphenous opening is covered by a septum, a sieve-like septum. The septum is called cupriform fascia. In the saphenous opening there is a great saphenous vein. When the great saphenous vein is entering the fascia or the saphenous opening, they give three branches. One to the medial, to the external pudendal vessels. One to the lateral, there is a circumflex iliac vessels, veins and flesh artery. They are superficial, and one is the above. What is the above present? Epigastric region, so superficial epigastric vessels. So it's clear. This is about the roof. Now coming to the main things, this is the contents. What are the contents present in the femoral triangle? So this is very easy. First of all, there is our femoral artery, there is our femoral vein, there is a femoral nerve. Clearly noticed, vein, artery, nerve. And the nerve is not a part of the femoral sheath. It's not a part of the femoral sheath. And sometimes there is another nerve, lateral cutaneous nerve of the thigh. Sometimes when it comes above the inguinal ligament, they are not content of femoral triangle. But when the lateral cutaneous nerve of the thigh come below to the inguinal ligament, then it is the content of the femoral triangle. And coming to the femoral sheath. So this is actually the femoral sheath which encloses the femoral artery and femoral vein. And there are three compartments of the femoral. Okay, first compartment, this is the medial side, this is the lateral side. The medial compartment is actually called the inguinal ring, present in the inguinal ring, where the femoral lymph nodes are present. I am talking about later. Next, or lateral to that, there is the venous segment. Lateral to that, there is the arterial segment. So femoral artery, then femoral vein, and the inguinal, the femoral ring. And medial to that, there is the lacunar ligament. And the lacunar ligament, highlight that. Lacunar ligament is a modification of the inguinal ligament. Okay, so lacunar ligament has a great association with the femoral sheath. Okay, now coming to the arterial segment. In the arterial segment, there is a branch. This branch is called the femoral branch of the genitofemoral nerve. The artery, this nerve followed the femoral artery. So this is the femoral branch of genitofemoral nerve. Okay, now coming to this part, this is then called the femoral ring, and there is the medial segment is called the femoral canal. So in the femoral sheath, the medial segment, while the femoral ring is present, we can call this is a femoral canal. And the femoral canal is very important because there are some lymph nodes. This lymph node is called that lymph node of Cloquet. Lymph node of Cloquet, it's mainly drain the glands and the clitoris. Okay, so it's very important, the femoral canal. Now coming to this nerve. Why this nerve is very important? Because it's actually supply the roof of the skin over the roof of the femoral triangle, and it is the main afferent fiber or the nerve fiber of the cremasteric reflex. So this is the very important. Now, so femoral sheath mainly formed by two layers. One is the anterior wall, one is the posterior wall. What is present in the anterior wall? We can know from the abdomen there is a fascia, and this fascia actually called fascia transversalis. And in the posterior wall, we know there is a iliacus muscle. So there is a fascia over the iliacus muscle. So this is called the fascia iliaca. So below there is a fascia iliaca, and above there is a, this is actually the fascia transversalis, and this is actually the fascia iliaca. So this is the anterior wall and this is the posterior wall. So this all about the femoral sheath, femoral triangle. Now you can clearly notice in the image below the femoral triangle there is another canal is present, and this canal is mainly just below the sartorius muscle. So this is called actually the subsartorial canal or the adductor canal or the Hunter's canal. So coming to the, what are the anterior boundary, what are the posterior boundary, and what is the medial aspect, what is the lateral aspect of this. So coming to the anterior part, there is the vastus medialis. Vastus medialis mainly from the anterior part, and the adductor longus part mainly from the posterior part. And we all know the vastus medialis or the adductor longus mainly associated with the linea aspera of the bone. Actually, vastus medialis originating from the linea aspera, and the adductor longus muscle is inserted to the linea aspera. And what is actually present? The medial side. What is the? This is not the sartorius. It is subsartorial. But there is another thing. This is actually the femoral septum. It's mainly from the medial part. Okay. So what are the content of the adductor canals? The adductor canal contains, first of all, what are the coming from the femoral triangle? Femoral artery, femoral vein. Okay. And one nerve to the vastus medialis is also present. So nerve to the vastus medialis. And there is another branch of the obturator nerve, and lastly the saphenous nerve. So there are three nerves. What are the nerves? Nerves of the vastus medialis, branch of obturator nerve, and saphenous nerve. It's very easy. And next, the most important thing is that the nerve to the vastus medialis is not seen the lower 1/3 of the adductor canal. So this is all about the adductor canal. Okay. So this is actually the transverse section of the adductor canal. You can draw this diagram clearly. Okay, I will provide the PDF in your WhatsApp groups. So this is all about the femoral sheath, femoral triangle, the adductor canal. Okay. Now I just want to mention, I definitely share this PDF where the muscles of the thigh, anterior and posterior, is included in this master chart and the diagram also. So I will provide the PDF in your WhatsApp group. If any problem, contact with me. I will definitely solve your problem about this. So this highlighted three muscles, this is actually called the hamstrings muscle of the thigh. Okay. Now coming to the most important part, the knee unlocking and locking mechanism. So the knee unlocking and locking mechanism, this is actually called the coupled motion. What's coupled motion? Who are the couple? First of all, there is a sagittal couple and there is a frontal couple. In the sagittal plane, the knee is flexes and extended. So this is the femur and this is the tibia. Just imagine, this is the femur, this is the tibia. So in the sagittal section, the flexion and extension is occurs. This is the sagittal section, the extension and flexion is occur. Okay. And in the frontal section, what you can notice? You can notice abduction and adduction. So there are two planes. One is the sagittal plane, what is the flexion and extension occurs, and in the frontal section, what is the abduction and adduction is occurs. Okay. So why this actually occur? This actually occurred because of the, this is the femur, there is the greater, and there is the medial epicondyle, and This is the condyle. The middle condyle is larger in size. So the axis of the rotation is slightly tilted. Okay, please clearly note. Please, what is the condyle is greater? Medial. So when the extension and flexion is start, this actually start from the laterally and go from the medially. This is the tibia. So tibia start from the laterally and go to the medially. So this is the femur and this is the tibia. If there is a femur and there is a tibia, when it start flexing from the laterally and go to the medially. Starts from the laterally, go to the medially. Starts from the laterally, go to the medially. Please clearly notice. So when the flexion occurs, the tibia goes more medially, Okay, if this point is clear, locking and unlocking is very clear. This is also called the screw home mechanism. Locking and unlocking. The locking is mainly by the quadricep muscles and unlocking by the popliteus muscles. There are two kinematics. One is the open kinematics, when the person is seated and want to open the leg. This is the open kinematic. When the tibia is moving, this is actually the open kinematic. And what is the closed kinematic? The sole of the foot is fixed. The femur is opening. Femur is moving. So the femur is moving. This is actually the closed kinematic. Okay. There are two kinematic. Please understand first the open kinematic. In case of the locking, when the locking is done, locking in case of knee extension. When the knee is extended, the femur gets stuck with the tibia and this is the knee is locked. And when the extension, tibia goes medially, so in case of the extension, tibia goes what? Laterally. So tibia rotates laterally. Okay. Last 30 degree of the extension and more in case of the last 5 degree of the extension, this movement is clearly noticed. And the condylar notch and the condylar ligament are taut in case of this movement. So when the flexion is occurring, tibia rotates medially. It is very easy. Tibia rotates medially before it starts the flexion. Okay. Now in case of the closed kinematics, just opposite occurs in case of the femur. In the knee extension, the tibia goes laterally. So femur, in case of closed kinematic, femur have to go medially. And in case of the knee flexion, tibia goes medially. So femur have to rotate laterally. It's very easy. One kinematic you understand, everything is clear. And if you don't want to remember all of these things, don't want to understand, there is a mnemonic for you all. First of all, the mnemonic for the tibia. Okay, just note L to M. Laterally to medial. When just add two lines. So extension to flexion. When there is a extended, tibia goes laterally. When there is a flexion, tibia goes medially. These are mnemonics. L to M, E to F. Just add two lines. Okay, clearly, it's clear to you all. So this is all about the knee locking and unlocking. Now coming to the animation part of the knee locking and unlocking. Please see the animation part. Now coming to the animation part, where you can clearly notice this is the femur, this is tibia, and this is the fibula, and this is the patella, and this is the knee joint. Now when it starts rotating, or when it starts, this is the anterior view first of all, and when it starts extension, you can clearly notice when the extension is occur, the femur is going, the tibia is going, and tibia goes laterally. Tibia goes laterally to the lock. So this is the lock position where tibia goes laterally. When the unlock is done, tibia first rotate medially. To better view, it is a medial view. to better view, you have to notice the superior posterior view. So this is the superior posterior view. Clearly notice tibia goes medially. Tibia goes medially. When the tibia goes medially, then it's come to the flexion. Then it's come to the flexion. So you can clearly notice when the tibia goes laterally in the locking position and tibia goes first medially in the unlocking position. Okay, when it is actually the open setting or open kinematics. When the closed setting or the closed kinematic is done, the opposite rotation is seen in case of the femur. Okay, thank you so much for watching this video. If you want to get the PDFs, join our WhatsApp group, and please give your valuable comment in the comment section. Thank you so much.